Dentistry in General Radio Network presents Dentistry in General official podcast with Dr. Bob D. In this episode,
within the first few months of having taken just their treatment planning course, I had three $30,000 cases say yes to me. I had never had that happen before. He was speaking and showing his cases and the type of dentistry he was doing, and looking at his dentistry, I knew, and that was the type of dentistry I've always wanted to do. There's always something to learn. Even as a business owner and knowing all of the, your business knowledge, still you can find yourself questioning, how much time can I take off? What does that affect? How do I keep my employees happy? How do I keep my patients happy? So it was just all of these pressures that I didn't expect.
Maximizing your dental practice growth through strategic CE investments. Dr. Bob D. interviews Dr. Darcy Neveu.
Hello everyone, I'm here today with Dr. Darcy Neveu. Darcy and I met the boost camp Dr. Paul Goodman runs, and I was listening to her lecture and I was touched by the vulnerability that she showed, telling everyone her story. And I feel like it's a story worth telling so others can benefit from. And as Darcy and I were talking, not everything is rosy out there. Not everything that you see on Instagram is the norm. As a matter of fact, 99% of it is not the norm. So I wanted Darcy to come on, and she's very successful now, but I want her to tell her story of why she is successful so we can help some young people. Darcy, thank you for being here. Tell me a little bit about yourself, where you went to school, and how long you've been in practice.
Yeah, so I went to Tufts University School of Dental Medicine in Boston, and I graduated in 2014. After that, I went into an associateship, actually at a pediatric office. So that was quite the experience. And I did solely pediatrics for about a year as I grew and developed a GP practice from within the pediatric practice. And from there, I was there for about 3 years. And then in 2017, I started practicing with the doctor who eventually I bought his practice from in 2020.
Wow, 2020.
I know the timing of purchasing the practice may have played a role, but it didn't.
Negative role, right? Or no?
Not really. I mean, it was interesting. So 2020, when I purchased the practice, was right when things were reopening. So it's when that boost of backed up work that needed to be done, people who were staring at themselves on Zoom all the time, realizing they didn't like their teeth. There was actually a huge demand whenever I purchased the practice. So I stepped in as an owner with more work than I could handle, honestly, as a solo practice owner. But people were so patient, which was great. I was booking whenever I opened 4 to 6 months out. My chair was pretty full, with the exception of having intentional carved out spots for those more emergent things, but it was not difficult to fill. So it actually became more stressful to me once I got to a spot of what normal scheduling looks like. Mm-hmm. And so I had to keep reminding myself, no, this is normal, because I was just so used to, I'm booked solid for 4 to 6 months. No one can get in my chair.
Yeah. Wow. Amazing. I want to tell people why I have Darcy here is because I'm very much intrigued and interested in learning from people who are successful now, but they struggled before. And you spoke about this. Tell me a little about your struggles and then what you did to fix it, because your formula is something that every dentist should basically implement. You hired a coach. You made sure you had certain amount of budget for improving yourself. All of those things are so important. And I didn't do any of it. And I would have been where I am probably 10 years sooner if I would have done that. I listened to the negativity online and I didn't hire a coach. I did the minimum CEs what I was supposed to do. I mean, I've changed since then, but I want you to tell me their story. Start from the beginning. What happened when you bought your practice? Tell me what difficulties you experienced.
So it was, honestly, there was never a financial struggle, which was good for me. Like I said, there was pent up demand by the time I had stepped into owning the practice. So that wasn't the struggle, but where the struggle ended up being was really mentally and emotionally, not really having the right expectations, I guess I would say. For me, being a practice owner was something that I always wanted to be. Even before I stepped into dental school, it was knowing I wanted to be a dentist. It was never, I want to be an associate dentist. It was, I want to own my own business. So that was always on my mind. And that was always a preparation of mine from leadership classes and books, all of that equipping as far as leadership goes and business knowledge. But then to actually know the game versus playing the game is totally different. So I use an analogy, the first boost camp I spoke at 2 years ago, relating it to my youngest son, Everett, playing baseball, where he had studied the game so much. He knows more about baseball. This kid knows every single rule at 7 years old. But then when he finally played the game, we had some videos of him and he completely missed third base running around twice, not just once, twice, but because of his third base coach, who was there to lead him back to make the right choice, he was able to make that correction. And it took a few times of practicing it and actually playing it to finally get it and have the competence and confidence to hit third base each time he goes around. So that's where I was at, where there was a lot of head knowledge and expectations of what it would look like. And I had worked in a practice for a while. I was 6 years out as an associate. So watching it and observing it wasn't anything new to me. And I had a great mentor who I bought the practice from, who showed me all of those things. But it was really not what I thought it was going to be, quite honestly. I was so used to going to work and being able to come home, and that was it. And even though I knew that would change, I didn't understand, and I wasn't fully prepared mentally and emotionally, neither was my family, for how much demand it really was going to be outside of what we were used to for the past 6 years of me working as an associate. So I was the one everyone was looking to for answers, and I felt like I had to have them all, and I didn't. Always having the excuse before becoming an owner that I didn't have enough funds to pay for the high-end CEs and do all of the things that I knew I wanted to do to invest in myself, to do the dentistry that I wanted to do confidently. So being in that place of, I feel like I'm spiraling because this is nothing I expected it to be, and having extreme buyer's remorse. I couldn't now just be the dentist. It was not just a part of what I did, but being a business owner now, it really ingrained itself as part of an identity, and I didn't like it. And I just wanted to give it back and crawl in a hole. And I wanted people to stop asking me questions. And I didn't want to stress out anymore about how much do I pay myself? Because these are some of the things that even as a business owner and knowing all of the, your business knowledge, still you can find yourself questioning, can I take time off? How much time can I take off? What does that affect? How much do I pay myself? How do I keep my employees happy? How do I keep my patients happy? How do I have people like me, but respect me at the same time and see me as a good leader? So it was just all of these pressures that I didn't expect. I felt very overwhelmed and very stressed by that. I just wanted to go to work and do my job and then come home. And that was a harsh reality that I faced, that I couldn't do that anymore. So I had a little bit of a breakdown, and thank God I have great people that I can rely on, like Paul Goodman. And that's who I called in like my time of need and what do I do? And he's the one who connected me to getting a coach, because it wasn't a numbers thing. It was obvious with my business knowledge, not to toot my own horn, but we had a good thing going financially. It was really more of a culture, morale boost that I needed. And that's where a coach really came in to give me that reassurance to say, you are doing a good job, and be that coach that, okay, just like my youngest son, Everett, you know what you're doing. You need to go back here and change this thing. You need to tag third base because that's very important for you to actually make the score. That's what a coach has done for me. And also to teach me things that I don't know. I don't think there's ever a destination. It's always a journey, right? There's always something to learn. And so I'm always learning something from her. And it's just so nice, especially as a solo practice owner, who for me, primary is always going to be my hands in people's mouths. I love that part of it. I also love owning a business now, but I love having that person that can cheerlead me on, who can reassure me, who can be my eyes in the sky, really, and redirect me when I need to be redirected, and just rely on it. It's huge.
It's so funny that you say that, because I sometimes exaggerate and say I never had a coach, but I had and I still do. I have an accountant who is a dental specific accountant. And every question I had, I went to him. He put all of my financial for things together, my retirement plan, how to do this. So in a way, he was my coach. It wasn't exactly the same type of coaching that you're talking about, but it helped me. And I also want to bring this up, and I always tell this to the young dentists that call me for help, is that we call ourselves professionals, right? You show me a professional sports person that doesn't have a coach, and I will. And I don't want this to be a advertising for coaches all around the country, but it is. It's what made you who you are and what made you who you are today. And I'm not blind. The majority of dentists graduating today are female dentists, and a lot of them are going to be moms. Tell me a little about how you handled that and how a coach helped you even in that department, because that is the most important thing that the women dentists who are graduating are going to think about.
Part of the reason I wanted to become a dentist is dentists would say how flexible it is schedule-wise to be a dentist, because you only work 4 days a week. You can make your own schedule. But honestly, I'm going to be super real with anyone who thinks that still. As a business owner, that is not true. There is a lot more demand on your time, maybe as an associate dentist, and you can be successful as an associate, but as a business owner, there is a lot more time demand on you. And I think it starts with support at home, the relationship that you do have with your spouse. I am super blessed. My husband is so supportive of me, and having the job and the income that we do have as dentists afforded us the opportunity for him to take a step back from his job as a full-time PT and be home with our kids. So having that support at home was really big for me, and his understanding of the season I was in. But then with my coach, it's really been a matter of delegation, of being able to, as a leader, equip and grow other leaders around me so that I can confidently delegate the things that I don't have to do to them. So it takes stuff off of my plate. So that's been one of the biggest changes, is not being so like micromanaging and it has to be my way and it has to be done this way, because that's like the perfectionism that most of us have as dentists, is trying to forget about the details. And as long as the destination is achieved, then it's okay. So taking the things off of my plate, showing me how I can do that, how I can help equip the people around me that I do have supporting me to do the things that I don't physically have to do, that they can do, so that I can focus on the things that I can only do as a business owner and that I can only do as the dentist. So that's been big as far as coaching and the balance between home and work, and finding that time to be a present mom, and then having a supporting spouse, really.
It's an amazing thing when you have support at home, and that I can't stress that. But I also wanted to bring up the CE aspect that impressed me when I was listening to you. I'm guilty of being one of those who did not have a budget for CE. And I guarantee you more than 90% of dentists are that way. They just, I like this one, I sign up. I like this one, I sign up. And they don't look at investment in themselves. I didn't. I'm not judging anyone. Trust me, I'm one of you. And the reason I'm interviewing Darcy was the two aspects that I think every young dentist should now consider in 2024. This is not the 1980s, right? You can't just hang a shingle and figure out, I'm just going to charge $23 for an amalgam and I'm profitable. Your staff is asking for more money. The insurance companies are cutting costs. And even if you're a fee for service, if you're out of network, your patients are still using insurance to pay your fees. It's still, you're being affected. And that's a lot of my activities with organized dentistry, to make sure our advocacy is there so we can help our patients. This is not about us putting more money in our pocket. It's helping our patients maximize the benefit they deserve so they can come to get the care they deserve. Your experience with CE, I know you said that you were like me. What changed? Who changed you? And how do you measure success when you go to a CE conference?
There was always this drive in me. I think we all have a level of that drive if we made it through dental school, right? But this deep drive and passion of, we talked about it, a little bit of competitiveness, not with other people, with myself, and always never settling for less. I've never been a person who wants to settle for less. I like to live in a world of contentment, but I don't live in a world of complacency. So I don't ever want to be complacent. And I've always been one to push myself and to grow and to drive and want to be the best that I can be, not only for myself, but as a dentist, for those around me, for the people I'm taking care of, for my team, for my patients. And always having this financial excuse of, I can't afford to go to the CE, even though this is what's going to get me to the type of dentistry that I want to do, right? I could still go on vacation. I could still make my car payment. So it was really a matter of priority for me. We see it a lot with our patients and we complain about it. We do the same thing to our vendors of, oh, that's too expensive. But it's the saying of I was being dentist cheap, because we are very cheap. And honestly, it started out, I didn't even care how much it was. I knew the money was there. I didn't sit down and do a specific budget in the beginning. I just wanted to start driving. There was a moment where it was actually at Super Dentist Boost Camp in Philly. It was 2021. I was a camper at Paul's Boost Camp, and it was Todd Fleischman. And he was speaking and showing his cases and the type of dentistry he was doing. And looking at his dentistry, I knew, and that was the type of dentistry I've always wanted to do. It's really more prosthodontic care, whole health comprehensive care, and cosmetic care. That's what's always interested me. So he was really that tip off for me, because he was also very transparent in this is what it took for me to get to the type of dentistry I'm doing. It was a lot of time and money investment in CE. And so finally having that person to say, this is what it takes, this is what I had to do to be able to do this level of dentistry, I just knew, okay, that's exactly what I have to do. And I finally signed up for my Spear Study Club that I had been avoiding. My orthodontist leads it and had kindly been annoying me for a few years about it. And I was always an excuse of money and time, mostly the money part. And I somehow magically found the money in the budget. Really, it was just a priority of spending the money for it. And then quickly signed up for my first course with Spear. And I just started driving, because I took that first class and I saw a huge return. Even just after that first course that I took, I came back very excited about dentistry again. And within the first few months of having taken just their treatment planning course, I had 3 $30,000 cases say yes to me. I had never had that happen before. But then it was, okay, I know how to treatment plan this, but I need to know how to execute it well. So I knew I had time because they were going to the orthodontist first, but that passion, it just, every time I just kept going and going, every time I show up, it's just so much more that I realized I didn't know and I didn't see in my patients. And I want to keep driving. And honestly, you talk about the organized dentistry and things like that, but you want to talk about financial, honestly, the only way you're going to be a successful, in my opinion, successful at becoming a fee-for-service dentist and a fee-for-service practice and not have that stress of insurance reimbursements hanging over your head, you have to provide the quality that can justify that. And the only way you can provide the quality that can justify that and have that niche that people want to come to you because they know what they're going to get from you when they walk through those doors, they have to want to pay for it. So you have to give them quality that they want to have to pay for. You can't just rip the Band-Aid off and say, I'm a mediocre dentist that knows maybe how to do a great class 2 filling, but that's all I can do. That's not going to drive a very successful fee-for-service practice if that's your desire.
Yeah, and I talk about this all the time too, and I'm a PPO dentist myself, and there's nothing wrong, in my opinion, about being a PPO dentist, and I'm sure you have been before, and we still do great work. The important message I want people to get from this talk is you can't just raise your hand and say, I'm a business owner. Every successful business in any industry spends money. Right? Yeah. Paul Goodman is going to love this. This is almost becoming a commercial for his Boost Camp. You learned all of those at an in-person event that you went to, and you connected. It wasn't a hands-on course. It was you sitting in the crowd and something ringing in your head saying, oh my God, this is what I've been looking for. Let me go get it. So there's a lot to be said about spending money on your business. Everybody wants to look at the bottom line and says, I took this much home, but what does that do? Where do we go to grow your practice from, right? So spending that money instead of on your Tesla payments, it's very important. I don't say this to offend people, is that, if you're driving a $200,000 car and then telling me that you're struggling in your business, it's not going to work, right? It's not going to work. You talked about the 2 things that helped you, spending money on a coach and spending on money and improving your skills. And when you talk about a fee-for-service practice, I don't want people to think that I'm advocating for that. It's not for everybody.
I'm in network with 2 insurances. I'm not totally fee-for-service myself yet.
Yeah, no, and that's what I want to tell you is that people who say, I want to be fee-for-service, they need to understand it's not just taking the CE and becoming a good dentist. Everything has to be first class. Your attitude. If you're not a person who's going to smile when you're talking to a patient, you can't be fee-for-service. people come to see you. That's what I wanted to a little bit talk to me about your practice. What do you do? I know you showed some slides regarding how much you spend and how much it went. Touch on that a little bit. I want people to know how much actually you spent. I want them to hear that. If it's a jolt for someone to put it into action, do it. Go to Paul's boost camp. For anybody who doesn't know, it's a boost camp for new practice owners or those who want to be a practice owner at some point. And I keep telling Paul he needs to put the word support there. It's a support camp, right, Darcy? It supports you.
Like good therapy.
It is.
Honestly, you're too cheap to pay for therapy. Just go there.
But tell me a little about you and what you did.
Prior to 2021, I was doing bare minimum, like maybe I was taking, all the free CEs that were out there that I could take to qualify my license, or if somebody else paid for it when I was an associate, I would go, but I wasn't really seeking anything out. So maybe a couple $1,000s a year, maybe. In 2021, I had went up a little bit, like $4,500 I had spent. But that was the year that everything changed. So going into 2022, looking back, I spent about $21,000 in CE. In 2023, I spent $45,000 in CE. And as of this year, it was in May that I had calculated it. I was about $25,000 in May. So I'm probably going to land this year around like the $40,000 mark again in CE.
Yeah, I mean, I feel encouraged and I feel envious and I feel proud as someone as young as yourself. I'm one of the old dudes, right? As someone as young as yourself reached the conclusion I'm reaching in my 50s, right? It's great. That's why I wanted you to talk about these. And people need to understand every industry, any business in any industry does this. They reinvest. She's not spending. They can take everything away from you except what's in your head. What's in your brain, they cannot take away from you. And that's what you're doing. You're not buying a beachfront property that you may or may not lose money in it, but you are investing in yourself. And am I correct to assume you have at least gotten 2x from your investments?
Oh, more than that, honestly. And I think of it this way too. If anyone really has a hard time wrapping their head around it, also the moment I really understood from the business perspective what reinvestment looks like from what you're paying the IRS.
Mm-hmm.
We call it, my accountant and I, this is my girl math. Okay. If anyone knows social media, my girl math is that it's 40% off. Right? So, every $10,000 I reinvest in my business, which investing in CE and myself is an investment from the business. It's $4,000 less I have to pay the IRS. I'm like, hey, it costs $10,000. It's 40% off.
It's a great way of actually looking at it. I'm going to say it in a way that I think about it is that you either pay it to the IRS or you reinvest in yourself.
Really, the way that the IRS is structured for business owners is for you, as an encouragement for you to keep reinvesting in your business. They want to see you keep reinvesting in your business and they want to see you successful. And the way they do that is you spend more on your business, you pay us less. I'm like, that makes perfect sense. Why wouldn't we? I'm going to ultimately, at the end of it, when I do the math, I'd still take home the same. It does not affect my take-home pay to make this reinvestment in my business. And I get some really cool travel out of it, honestly, and experiences on top of the knowledge that I'm gaining. So it just makes sense. Still, it doesn't affect my take-home pay, but it affects how much money I'm paying the IRS.
Yeah, and they do this, and they're not dummies either, right? They're your partners. They're the only partners I have other than my wife, because every dollar that you take in, 30% goes to another entity. So they want you to make more so they can take more. It's really simple math. Now, what I wanted to touch base here at the end, the last thing I want to talk about, which is, in my opinion, the most important thing you talked about in your lecture for Paul Goodman's Boost Camp. Another plug for Paul. He'd love it. By the way, he has not paid me for this. This is just a discussion to benefit dentists. We have neither Darcy and I have any financial benefit from plugging the Boost Camp. I just feel like it's it's very helpful. But what you talked about, the burnout, the reinvestment in yourself, helped your burnout, helped find out your worth, that I am doing something good. Talk to me a little about that.
Yeah, so I think burnout, it's a pretty popular term right now. At least I hear it more and more, burnout, but not really a whole lot of definition about what that means from people. It's very subjective to what our burnout looks like. I think for me, hitting burnout was just hitting that point of like, I'm not enjoying this anymore. There's something about what I'm doing I'm not really enjoying, and I'd rather be doing something else. But understanding that's pretty normal, and that's just a part of life. We experience it not just with our careers, but in relationships, in like other circumstances in our lives. And reinvesting in myself, understanding a mental strength was big for me. Understanding, reinvesting in myself as far as taking time for myself, like physically, my health, not just my physical health, but my mental health, my emotional health, taking care of that and making sure I was taking care of that was very important, on top of the reinvestment in myself as a professional and taking the CE and showing up at networking events and staying connected to different people also helped support that mental strength and that emotional health, because it really just keeps that flame going for us. At least it does for me. Every time I show up to a CE, every time I talk to another dentist friend, it always just reignites that original passion that I know we've all had. Otherwise, we wouldn't be doing what we do. But we can see if we're not tending to the flame, it can burn out. I think with anything that we want to be successful at, in my career, it was seeing it as, I have to keep fueling this fire. How can I keep fueling this fire? And it was making the right investments in myself, carving that time out, and then carving it out professionally, investing, realizing the most important things around me in life really are people as well. From my family to my team to my patients, people are what make our life flourishing. And those relationships, investing in the people around me as well. And the best way I could do that was be the best version of myself. And so that's where you really have to spend some time and money and think some self-reflection and what it is for you to invest in yourself. How can you be the very best version of yourself so that you can be present for the people around you, that you can be the best you for the people around you? Because ultimately that's what's going to be fruitful in your life. And I think that's where success is really going to come from. It's not going to come from how much money you bring home. Yes, we want to pay our bills, and it's stressful if you're in a situation where you can't, but I am a firm believer that you reap what you sow. And so if you are sowing in the right places, it is going to come back. There are going to still be struggles. There are still going to be low times. Don't get me wrong. There are still moments that I'm like, why am I doing what I'm doing? I'm seriously questioning my life choices. But really, when you take a moment and you have those tools to sit back and realize what you have to be grateful and thankful for, I think that's where your success is going to come from. And it's so much more fun and less stressful the better you are at it. Anything you do, the better you are at something, the more fun you have doing it.
Great. Thank you for sharing that. And I also want to mention at the end here that you're going to hear from Darcy at hopefully at Spears, and you have the boost camp that speak. Usually it's in August, I think, right? August. Yes. Every year.
It'll be this next August. I'm one course away from being able to become a visiting faculty at Spear. I'm taking it in 2 weeks.
Excellent. We're rooting for you. And I also, at the end, I want to tell people that the message of this interview is that, first of all, you're not alone. You have so much help these days with technology. Yes, there's a lot of noise out there. We need to cut that out. But the support is there. People like Darcy, people like Paul Goodman. I'm available anytime anybody wants to talk. But the message is, you can't just claim you're a business owner, you're an entrepreneur. You have to do something about it. And that is reinvesting in your business, reinvesting in your education and yourself to be able to be successful. Do you have anything else to add at the end?
I think just hang in there. Don't be afraid to reach out and be vulnerable. I think is a huge piece of advice I wish someone would have given me, that odds are if you're struggling with something, you're not alone in that struggle. So no, you don't have to do it alone. And there are people around you that want to encourage you and want to support you and want to be there to pick you up out of the pit you might be in. But we just can't do it if we don't know that you need it.
Great. Thank you very much for spending the time with us. And hopefully we can see each other in August.
Yeah. Look forward to it.
Thank you.
This has been a production of Dentistry in General Radio Network. Visit our website, dentistryingeneral.com, to join engaging clinical and business conversations, explore our dental podcasts, and stay updated on our upcoming live event.